great to welcome Dr. Selman back, Dr. Cheryl Selman. In the past, we've talked about the dangers of the birth control pill, and it's pretty scary. What would you suggest is an alternative relative to birth control?
Well, let's talk about that because there are different reasons why women are recommended to go on the pill. If we're looking at the birth control pill to prevent conception, well, there are no safe versions of the pill. All versions of the pill use synthetic hormones, which are known human carcinogens, in higher doses than are found in hormone replacement therapy. So the nature of the pill is to mimic pregnancy, which is a time in a woman's life when she's producing high levels of hormones. That's how the pill works. So there is no particular variation on a theme of the pill that would be considered safe. If you are choosing to take the pill, what I recommend, first of all, is to be sure to take good nutritional support, because the pill will deplete most of your key vitamins, minerals. It affects your essential fatty acids. The pill actually acts like an antibiotic in the sense that it will wipe out your good gut flora. So more women tend to have issues with candida who are on the pill. So if you are taking the pill, you need a good multi-mineral, a multivitamin. I think you should be taking a good probiotic, a good antioxidant, and you probably need a really good essential fatty acid as well. Those are fundamental.
Let me interrupt you for a second. Did your doctor tell you that? Do you know, do doctors let anyone know about that?
Well, in talking to thousands of women, and actually when I talk to the audiences, I always ask the question, now how many of you have been fully informed of the pill and some of the dangers and risk factors? And hardly anyone raises their hands. The thing that women are told is that don't worry about it, this is safe, this is good for you. As we now know, the pill is being prescribed for the purpose of helping women to totally eliminate menstrual cycles for the sake of not having any menstrual cycles, for no other reason. It's an alarming trend. It's a very scary trend. I am out there warning women because the early use of the pill, in fact, the earlier a girl uses the pill, the greater her lifetime risk will be of developing breast cancer. The pill is not a safe, benign drug. It has serious consequences. So when you are on the pill, you must have proper nutritional support. It is advisable to take a break from the pill, ideally after about 2 years. Take a break, and I have known women who've been on the pill consistently for 20 and 30 years, thinking that they're having a period every month because they're just totally uninformed about their body and what's going on. So it's a good idea to take a break and get your body healthy again. It's a drug. All drugs have a toxicity effect on the liver. So we need to take a break and support our liver in detoxifying, help to replenish our good gut flora. The pill can affect our digestion. We need to get healthy and really support our body after dealing with the pill. In my experience, if a woman is put on the pill for PMS, because the pill is prescribed for painful periods, heavy periods, lack of periods, endometriosis, ovarian cysts, a variety of issues. In fact, just about every issue that a woman has, if she goes to her doctor, she will be prescribed some version of birth control. And yet these are all symptoms that her body is out of balance, that her health is compromised in some regard, that she is deficient in key nutrients, that she's stressed. There's something going on. And it makes little sense to me to put a woman on a pill that suppresses ovulation with toxic carcinogenic drugs when she is already not being her best, not having the optimal health. It will only further compromise her health down the track. I remember in my research coming across a quote from a billionaire who makes fertility drugs. And he actually stated that his best customers taking his fertility treatments were women in their 30s who took the pill as teenagers and 20-year-olds. So there are serious consequences from the use of the pill, which unfortunately in this day and age is being prescribed as candy to women of all ages.
Quickly, 3 alternatives to taking the pill?
Well,
understanding when your cycle is. What are some alternatives? Quickly?
Well, here's my list from the least preferred to the Best preferred. And I want to say something about the pill also before I forget, is that if you are on the pill increases your risk of developing cervical dysplasia, the human papillomavirus, which is being talked about a lot, which is one of the key factors and probably the key factor contributing to potentially cervical cancer, is exacerbated by taking the pill. You are at greater risk of developing this virus and having a more virulent form of this virus and being at risk of developing cervical cancer. So what we really need to be doing is to find other alternatives. Here they are. First of all, you can have an IUD. There are risks associated with an IUD. So that's an option that doesn't require hormones. Then there is the barrier method, and we have things like diaphragms and condoms. You know, even if you are on the pill and have multiple partners, you really should be using a condom because you're still at risk of getting, sexually transmitted diseases. Right. And my most preferred approach to conscious birth control, which is, it takes a little more effort, and certainly women need to get educated about their own bodies and have a committed partner, but that's to work with all the signs and symptoms. It's called natural fertility awareness. Mm-hmm. And it is really addressing the key changes that happen in a woman's body so she becomes so finely attuned to her body. She can be taking her temperature, looking at her cervical mucus. She could be charting, noticing how she's feeling. There are some devices that can actually show that she's ovulating, and really tuning into her body so she has this level of control and really attunement to herself. She knows when she's ovulating, and then at that time will make appropriate choices if she doesn't want to conceive. But that, to me, is the real epitome of a woman stepping into her power. I want to say that when a woman is really able to tune into her cycle, tune into her body, she actually is that approach to contraception is as effective as the pill.
Great. Thank you so much.
You're welcome.